Good afternoon, everyone. I hope you've had a chance to take the Blue Marble quiz that we've had up on the screen. Or if you haven't, take a few minutes at the end of the webinar. It's really fun, and hopefully you'll learn something. And share it with others, share it with your family, share it with your colleagues. So I'm Karobi Acharya. I lead the Global Ideas for U.S. Solutions team at the Robert Wood Johnson Foundation, and I'm your moderator today for our 18th, I can't believe it, 18th episode of Reimagined in America. If you're returning to the series, welcome back. And if you're new, joining us for the first time, we're really excited to have you. As we get started, I want to take this opportunity to recognize and acknowledge that New Jersey, where RWJF is based, is the ancestral lands of the Lenape people who were forcibly removed from their land and relocated west and north. While this land acknowledgement is one very small act to pay respect to the original caretakers of this land, our team is also committed to continue learning about truth, healing, and repair processes globally, understanding our history and the legacies of structural racism and colonization as determinants of health, and questioning how knowledge is produced, recognizing the erasure of traditional ways of knowing. Before we dive in, let me go over a few logistics. If you want to turn on closed captioning, just select the Live Captions button at the bottom of your screen. And you can submit a question at any time for any of our speakers by clicking on the Q&A button, also at the bottom of your screen. In addition, this webinar is being recorded, and everyone will get an email early next week with a link to the recording, as well as any resources that we discussed today. So I want to ask you to use your imagination for a moment. Close your eyes if you want to, and picture cable cars flying across Los Angeles that are connecting disenfranchised communities with the city center. Picture grandmothers on park benches counseling people suffering from common mental illnesses. Or think about housing developments that bring people together from all generations to form communities. Do these ideas seem a little far-fetched? Well, they shouldn't, because they are already being done in places around the world to address some of the most pressing barriers to health equity. To move the needle toward health equity, we have to keep track of how the landscape of our work is changing, not just in the US, but globally. And RWJF partnered with Dahlberg and a group of global health experts to identify health equity trends that are emerging around the world and to understand what those implications are for the US. All of the trends highlighted and the ways that the countries are grappling with them show that we have the power to transform inequitable institutions, systems, and social practices that obstruct equal opportunity. So as I see it, there are three ways that this trend sensing effort can help to move us forward. First, it's recognizing that health equity is a universal goal. Many countries, including low-income countries, have made great progress. In Rwanda, for example, government health reform has reduced maternal death rates by 42%. 42%. Second, global learning offers practical solutions, and it offers solidarity with peers around the world. We saw this in full force during the COVID-19 pandemic when countries joined together to address a global health emergency. And third, the world isn't static. It's constantly evolving, and we need to understand the trends, how things are changing, and in what direction. Our lives are too interconnected to pretend that what happens in Peru or Japan has no relevance for us. We need to know how other countries are addressing global trends. How is Morocco, Spain, or Portugal building wildfire resistance? How's Kenya supporting women entrepreneurs to start their own childcare businesses? How are Finland and Norway combating health misinformation and building health literacy? By opening ourselves to ideas and experiences from outside our borders, we can build our own efforts to advance health equity in the US. You never know what might spark an idea for your own community. So I hope you come away from this discussion feeling inspired by the solutions that other countries are implementing and with a new view to advancing health equity in the US. I'm really grateful to have three amazing speakers with us to share more today. But before I get to the speakers, we want to hear from all of you. We have two questions for you, which you should see on your screen. The first question, which of these health equity trends do you see in your own community? And check all that apply. And then the second question is, why did you join today's webinar? And again, you can check all that apply. So I'll give a minute for folks to check, and then we'll look at those results. All right, just maybe another minute. Please submit your responses. And then Kyle, you can let us know when we're ready to look at the results.
Sure thing. At about 65% now, so we'll leave it open for about 15 more seconds. Okay, I'll be closing the poll.
All right, what did we find? Wow, so the trend that got the most votes in terms of what you see in your community is the housing crisis. 75% of you said that you're seeing that in your community. And then second was equitable care work. So that's really interesting. And then I think the third, yeah, is healthy public spaces. So that's very interesting. And then in terms of why did you join today? 77% of you want to know more about trends in health equity. That's great. You're in the right place. And then understanding what we can learn from other countries and looking for the solutions you can bring to your own community. And I want to give a shout out to the three people who never miss a Reimagined in America webinar. You are my favorite people today, and we hope to see that number grow, but that's awesome. I love that. All right. Thank you all so much for that. So let me introduce our speakers. Zubaida Bai is the president and CEO of Grameen Foundation, headquartered in Washington, D.C., and boasts over 2 decades of experience in the social impact sector. She's a passionate social entrepreneur and advocate for women's and girls' health and reproductive rights, and is now focusing on financial health. George McGraw is the founder and CEO of Dig Deep. Dig Deep is the leading nonprofit focused on closing the water access gap in the US. It conducts groundbreaking research, spearheads community-led water infrastructure projects, and amplifies advocacy efforts across the sector. George also serves as the vice president of the Board of Water and Power Commissioners for the City of Los Angeles. Ben Wise is an associate partner of Dahlberg Advisors, where he co-leads Dahlberg's U.S. Justice, Equity, and Economic Mobility practice. He brings 15 years of experience in strategy and social impact, working primarily in the US, Latin America, and East Africa. Welcome, and a huge thanks to each of you for being here today. So I'm going to kick off with a couple of questions of my own, and then we're going to go to audience questions. So remember, you can submit a question at any time on through the Q&A button. Please use the Q&A button versus the chat, because it just helps us to track the questions a little bit more easily. So let's begin. Ben, as I mentioned earlier, we set out to identify key global trends in health equity with the goal of applying those learnings to the US context. of course, you and your organization, Dahlberg, have been absolutely central in leading this global trend sensing effort. So, could you maybe start by just giving us a flyover of what are the trends that you found?
Great. Thank you, Karobi. And it's wonderful to be with you all here today and speaking about this quite unusual report. So I work for Dahlberg Advisors. We're a social enterprise, global strategy consulting firm focused exclusively on social impact work. We work with nonprofits, foundations, and government agencies. We do a lot of these kinds of reports. But what was special about this one was the way in which we leveraged sort of a dual approach to trend sensing that mixed both some quantitative analysis using Google search trend data and also with qualitative insights from experts on what trends have been bubbling up to the surface in their own work. And central to this was Dahlberg and the foundation worked together to convene this amazing advisory board of leaders with experience in different aspects of health equity, the two of whom are here on the panel with us today, Zubaida and George. And it was in this group that we really did our core sense making and figured out where the research was really coalescing. And now, Karobi, to your question, what were our findings? So what we found were six major trends in how the health equity landscape is changing around the world, each of which holds something for the US to learn from. The first one is growing calls for more equitable care work. Now, odds are every single one of us on this call either has been or will be a caregiver or receiver in our lives. But while this notion of caregiving is on the one hand an equalizer that connects us all, on the other hand, the amount of care work that we each do and the compensation we may or may not receive for it is deeply unequal around the world. And the sheer amount of unpaid care work going on around the world is quite staggering. If it were paid, it would be about 9% of global GDP. And the vast majority of that work is performed by women. So what we're able to document in this report is that some countries and cities are really out in front of the rest of us in tackling this inequity head on, both at the level of national policy, but also at the level of community-based interventions. And we have Zubaida here today, who brings a great deal of expertise on this topic. So we'll look forward to hearing her perspective on this trend in a few minutes. The second one is greater longevity. Life expectancies around the globe are increasing, but these additional years, they're not always healthy ones. So we looked at who is on the cutting edge of promoting lifelong health and engagement and compiled examples from places like Japan and Germany, but also from Zimbabwe and India, all where there's areas of cutting edge work. Number three, a surge in digital health information and its impact on well-being. So there, as many of you likely know and experience yourself, there's more information and more individualized information about our health available now than ever before. And this can have huge benefits, but access to information about one's own health, that is not equitably distributed and generally falls along income and digital literacy lines. Fourth, and saw that there was some energy around this one in the group, is a compounding housing crisis. So why is this one important? The literature tells us that housing is quantitatively the most powerful of the social determinants of health. To put that another way, if you don't have a stable home, it's really hard to stay healthy. That's intuitive, but we also have a lot of data proving that this is the case. And so what's the trend? What's changing here? This is where we see the intensifying forces of things like inflation, climate change, migration, urbanization, and they're all exacerbating what has been sort of a secular trend, and it's bringing many cities around the world to a real breaking point. So that's what we explored under that one. Number five, increasing risks to nutrition security. Here we similarly have a longstanding trend that's just been getting exacerbated by some of these macro global forces. Again, it's climate change, inflation, and specific global shocks like the Ukraine war that are worsening nutrition outcomes around the world. And then lastly, growing demands in a post-pandemic world for healthy public spaces. So the COVID-19 pandemic really sparked a redefinition in how many societies think about and use public space. And we documented in the report what one practitioner referred to as a global awakening to the fact that public spaces, they're not a nice to have, that vibrant and inclusive public spaces can really be a significant driver of health and well-being outcomes. So that's a quick overview of the 6 trends. They're not intended to be comprehensive, but to really capture some of the largest tectonic shifts that are going on around the world in health equity. We've gone to great lengths in the report to document them quite carefully. We have over 100 citations in the back. Most of them are hyperlinked if you want to ever check those out. And the report is really chock full of these concrete examples that if you're a practitioner, you may or may not be aware of some of them, but each one documenting something that the US can potentially learn from. So I'll pass it back to Karobi and excited to get into the rest of the discussion today.
Thanks so much, Ben. I mean, it really is such a rich set of trends, and I think we could spend a webinar on easily on each one of them. But George, let me come to you now, and as Ben mentioned, part of the process of developing the report included really looking at concrete examples about how communities and decision makers are responding to these trends. So tell us a little bit about what you learned and how those approaches inspire progress in the US.
Absolutely. Thanks, Karobi. I'm also really excited to be here. I'm especially excited because this project is really cool. I haven't been part of something, or I've rarely been part of something that kind of reverses this model of international development, where so many ideas, I think, if you think of the marketplace of ideas originating in high-income countries, places like the US, where we, develop these amazing models and then export them through aid or through investment to other countries. And this shows that a lot of the best ideas in how to tackle some of these really emergent health equity issues are already existing in other countries, many of them lower middle income, and that we can learn from those here. So it's been such a pleasure to be a part of this project. One of the coolest things is that we got to visit some of these interventions in person. Zubaida and I spent some time with our colleagues in Colombia, in Bogota, where we visited one of my favorites, which was called Transmicable. Transmicable is this really innovative public transportation project that really fits well into our trend of growing demands for healthy public space. So it links this previously really inaccessible part of the city called Ciudad Bolivar, where there's almost 750,000 people living on a hillside. And it would take 2 to 3 hours for people to get from the top of Ciudad Bolivar down to the base, just so that they could get into the city and begin their commute to work. And so this is a really innovative model that uses essentially a ski gondola to bring people from the edge of Bogota up into Ciudad Bolivar, cutting their transit time from 2 or 3 hours down to just like 9 to 15 minutes, depending on where they are on the cable. And if that wasn't enough, the way the system was designed, I think, is what's really special about it. It involved a tremendous amount of community input, and you can see how that buy-in has made this a really successful project. I mean, it's been in place for years, but you ride it and it seems like it was built yesterday because it's so clean and well cared for. At each of the stanchions, or like the 4 stops along the Transmicable, they built public infrastructure, things like care centers, which I know Zubaida is going to talk about, places for people to access government services, also parks and markets and public art projects. And to see all of these incorporated into one thing really shows how we can be reimagining our public spaces to make them work for us better. One of the other things in this project that we checked out is an example of a public space, but also an example of how we're responding to this growing trend for greater longevity. And it's in Japan. Japan has what they call these ibasho communities. Ibasho means basically a place I belong, or a place of togetherness. And the first ibasho communities came out of the 2011 earthquake and tsunami, where Japan's increasingly older population was looking for ways that they could give back and participate more in those cleanup and resiliency processes. So it started as a project and has since evolved. This ibasho community on the screen has since evolved into a community center where there is a community garden, a cafe and ramen shop, a daycare, a place where people celebrate holidays together, And this is not only a model for, how to engage aging folks in our population in a more meaningful way as a real resource, but also how to do it in a way that promotes climate resiliency. This is a place where folks can gather in case of emergency and organize themselves. It's also, again, a way that we're reimagining public space. And this model is being replicated in Nepal and in the Philippines, and so we already know it's kind of got legs. There's something really sticky about it. Like many of the trends that we looked at and the solutions, these are sort of really focused on maybe one of the trends we're seeing, in this case, greater longevity, but end up multi-solving for multiple trends at once.
That's great. Thanks so much, George. Yeah, really interesting examples. Zubaida, I want to turn to you and dive into the care work trend. Obviously, there was a lot of interest in that. And just the statistic that Ben mentioned is stunning in terms of if care work were paid. I think you said 9% of GDP. I mean, that is a staggering number. Tell us a little bit about, what is changing and how other countries are working to build safer, more equitable care work, and then what lessons you're seeing for the US.
Sure. Thank you, Korobi. I would like to second George in starting by saying that this report's very close to my heart because I have been fighting for the cause of invisibility of women, both in product design and systems design. And I think this kind of brought to life in many ways me leading the care economy vertical. For me, if you can imagine every day, all day around the world, women are busy cooking, they're cleaning, they're caring for their children, the elderly, the sick, right? And these are all crucial tasks in our everyday life. It's for the well-being of our communities, our families. That's how we survive as a family unit. And all this work often goes unpaid and unrecognized, right? And if you're going to add up all these hours, statistics say that it accounts for about 16.4 billion hours. I want to reiterate that 16.4 billion hours of unpaid care work that women provide globally every single day. And as Ben mentioned, I think this is going to add to 7 to 9% of GDP, which approximately equals to about $11 trillion of contribution to the global economy if we were to value it. Now, if we look at the enormous amount of work that women do and the potential economic impact, if only it was acknowledged, forget about it was being compensated, if only it was acknowledged, I think it's going to add a huge value to the way we perceive care work on an everyday basis. And I think there is a very strong link also between unpaid care work being primarily done by women and how climate impacts that, and how does that burden disappropriately fall on women? And you'll see that throughout the report on how climate kind of plays a role in that. As we move forward, I think we're also going to look at, and we might talk about this a little later, but it would be amiss if we don't mention the aging population, right? We're looking at by 50, the is going to be about 7 percentage points, very specifically in the US. And we're going to see that the burden of care is going to fall on women. Because if you look at the statistics today, which we mentioned in the report as well, that women make up 75% of the caregivers in the US, and 90% of the paid caregivers are also women, right? And we are seeing that on an everyday basis, about 50 million Americans provide unpaid care to their loved ones. What can we do to solve this, right? Given that this is associated also with the greater mental health burden that women face. There are so many facets of it. It's so multidimensional. As just picking up from what George was saying, we did visit Bogota in Colombia. And what we saw there was for every 20-minute walk, there was actually a care block, right? Which is an amazing intervention or a systems design intervention by the local government, where for every 20 minutes you could go to a care block, you could walk in and say, I want to exercise and I'm going to drop my kids, or I want a massage, or I want my laundry done, or I just want to do a yoga class, or I want to go get legal guidance, right? And they have about 40 care blocks in Bogota. And the statistics say that since 2022, they've saved about 770 days of labor for caregivers. So if you can think about it, just by a systems design intervention, and as George mentioned, I think even in the Transmi-Kaple, where it is a very short distance between kind of Bogota to the top of the hill, there is a care block at one of the stations where women can actually go in, drop their children, and get government services, get their forms filled, get their forms submitted. So just a simple intervention like that can go a long way in providing caregivers the flexibility that they need and the self-care that they need to reduce mental health care burden. If you go forward and look at some other countries, Uruguay is another country that has had a revolutionary approach where they launched a Caregiving Act in 2016, where every child, not only just every child, but every child with disability and every elder can access free care from the state, right? So that was an amazing intervention by the government of Uruguay. If you move from there to Germany, in 2012, Germany passed a law where individuals could balance caregiving and work responsibilities, where they could borrow against the future wages and kind of take time off to care for their family member, or they could work part-time for up to 2 years and retain 75% of their salary. I think all these are very easy, well thought of interventions where, given the state of care burden today that individuals face in the US, there is a lot for us to learn from these laws, these policies, and these interventions to be successful at taking care of our population.
Thank you so much, Zubaida. And of course, this is only going to increase, as we've talked about longevity and the needs for this. So yeah, really, really fascinating. Uh, One of the things that came up during this report is that there are two trends that are sort of affecting all the other trends in a very big way. That's artificial intelligence and climate change. And so I wondered if you each could maybe say a couple words about how are you seeing climate change and AI influencing these trends? How are they interacting with these trends? So I don't know, Ben, do you want to start and then go from there?
Sure. And yeah, it was interesting as we explored in the research. At first, I think we thought that these two would be trends alongside the other six, but the more we investigated and the more experts we spoke with, they were really just these kind of mega forces that were driving and affecting each of the others. So they were really cross-cutting in a way that just emerged organically from the research. And so that's how we've treated them here as kind of cross-cutting themes. And I will just highlight one that I found particularly important and really struck me, which is the leveraging of AI in the surge in digital health information and the implications for health equity. There's this incredible stat, 30% of all of the world's data is health data. And this role of technology and more recently AI, while the potential for improving outcomes using using AI in healthcare is incredibly exciting, it's contributing to this increasingly uneven playing field, not just within a health system, but more broadly in the realm of social determinants. So if you have a high income, if you're well educated, if you're digitally literate, you're much more likely to be able to step foot into the health system more empowered, knowing more about your own health, visibility into different types of health information, general health information as well as your own. And there's really a new imperative in health equity to equip marginalized groups to level the playing field before you even step into the four walls of the healthcare system. And the report highlights a number of examples where this is, there are kind of grassrootsy efforts in some cases that are really delivering on this imperative already. And they're doing this through two things. One, the smart use of digital technology and AI, but then marrying this with really thoughtful and often very robust participatory design processes that basically allow for the design of apps and technology tools, et cetera, they're very actively designed to solve for the most marginalized parts of society. So a few examples, there's these Ask Nivi chatbots, they're WhatsApp chatbots that are in use in India, Nigeria, Kenya, Venezuela's Aya Contigo platform. It's an app focused on abortion self-care
Thanks, Ben. Who wants to go next? George, you want to go?
Yeah, sure. I also had so much fun sort of looking at and incorporating AI across all these trends. We were really lucky in the cohort to be joined by Dr. Ivor Horn, who's the Chief Health Equity Officer at Google, who really early on in this project was like, okay, let's pull out AI as a trend and then let's see how it maps to all the trends we're looking at. And so that's why you'll see it so deeply integrated, which I think makes this report like especially timely. I was the godfather, the granddaddy of the climate change impacts on this report. So just like Zubaida led the care economy, I focused on climate change and its sort of interrelatedness to all the trends. And so Shelley Mitchell asked in the Q&A, you know, why that's not one of the 6 trends. Well, the reality is it's all of the 6 trends. You know, the UN member states have called climate change the single greatest threat modern humans have ever faced to our survival, and that's absolutely true. And while we started looking at this as a standalone trend at the very beginning, we ended up incorporating it across all the trends. So as you move through the report, not only is there a dedicated climate change sort of section at the beginning to help ground you in our thinking on that, you can see in the ways we're linking the trends to each other and the ways we're linking trends to climate change and each of the trends themselves, what our thinking is. So to give you some examples, I'll just use the same 2 I've already been using. First, the Transmicable. Obviously, we have to completely rethink green infrastructure, especially green transportation infrastructure in these massive cities that are so densely congested, like Bogota, which is incredibly dense. A lot of people not only ride the Transmicable up and down into Ciudad Bolivar, which is, you know, greatly reducing the amount of petrol-fueled vehicles on the road, but also when they get down to the end, there is bike parking for, you know, hundreds, thousands of bikes that people can then take into the city to their jobs, and we saw that being tremendously used. For longevity, I think climate change forces us to ask the question: how do we ensure that the needs of elderly folks and those with, you know, say limited mobility or handicaps are being incorporated when shifting us to more climate resilient communities? Not only that, but like, you know, not only how are we making sure they survive, but how are we making sure that they're empowered to lead some of those efforts and that their knowledge, the resource that they really are as elders in our societies, are being leveraged as we face this really unprecedented crisis. Again, the Abasho communities and some of the community centers that we looked at in Japan are a really good example. They're doing elder-led, you know, climate change and disaster risk mitigation sessions. I mean, mostly because these came out of the Fukushima disaster and the related earthquake and tsunami. These are helping those elders sort of like prepare for and equip them to navigate climate change and natural disasters, which are going to become more common over time, but also to lead those efforts, which I think is really remarkable. One final thing that actually came from our colleagues at Dalberg that I really love about this report is in the climate change section itself, you can see that many climactic zones in the US really mirror the climate change realities of other regions of the world in terms of like the temperatures, what kind of, you know, weather we're facing, what kind of natural disasters you might expect in these areas. And that means that like the southeastern part of the United States, for instance, which looks maybe a lot like Argentina, could learn from Argentina's resilience and adaptation strategies and vice versa. The same thing for Los Angeles and Morocco. And I think more opportunities for us in cities like Los Angeles, where I live and work, in agencies like the Department of Water and Power that I lead, you know, being able to look to countries in North Africa and say like, okay, what are they doing? Even not yet at scale, just like what ideas do they have that we could really implement here? Because we are facing ultimately the same challenge in a way that's going to really parallel our experience in both places.
Thanks so much, George, and thanks for mentioning that map. I that's one of my favorite images from the report as well. It's just it's so powerful to see other other countries sort of superimposed on the US and understand how much we share in, in this particular case, in terms of climate threats and as well as possible solutions. Zubaida, would love to hear your thoughts about how AI and climate change are intersecting with some of these trends.
No, thank you, Corby. And I think for me, the way I'm looking at it, when I move away from care economy, the next trend that I see that intersects immediately that leads to climate and AI is longevity. Because we are going to see that by 2030, we'll have 20% of the US population, as stated in the report, will be over 65 years of age. 30% of those adults will not be economically secure, and over 50% of them will have some form of a chronic disease. So if you're going to put that in perspective, we really need to eliminate burden of care. We really need to have some form of an AI intervention here to help enable personalized care in a way. And, deviating a little bit away from the report as well, I was in a conference yesterday where I heard that in India, there are only about 20,000 radiologists for an entire country of 1.4 billion people. And that basically means you have one radiologist for every 100,000 people. And that's way the WHO standards. But what they were able to do was use AI. They sent trucks into rural communities and they got bulk x-rays of people. And they only triaged people who they saw were of high likelihood of getting tuberculosis. That way, they were able to use AI to narrow down the number of people the radiologist should see who were high risk and able to ensure that everybody got the right treatment, right? So that's one example that's outside of the report where AI is making a huge impact in terms of how do you use the resources that you have to enable and provide the right kind of treatment so that these people are not, so that they have a longevity in their lifetime and not just age with many chronic diseases. That's one example. I think in the work that I do at Ramin Foundation as well, I think we are seeing the climate impact at the last mile, and obviously the disappropriate burden of high heat, lack of access to resources within vicinity, all this burden falls on the woman. And what we are seeing is there have been climate interventions where floods were just given in 24 hours. Now they can give you 7-day warnings based on AI models to say, okay, this place is going to be flooded, please relocate. So I think there's definitely a very close relationship between how AI models can enable people to be better, can enable predicting better weather patterns, and how that will have an impact on longevity and eventually the care burden that women face.
Yeah, thank you so much. So we're going to go to audience questions now. There are, if you haven't already submitted a question, please feel free to send a question in through the Q&A box on your screen. And let's see what we have. And I actually think we can take the slide down if that's okay. Ryan, yeah, thanks. Okay, so let's see what questions have come in. Okay, well, since we were just talking about AI, here's a nice easy one. What kind of guardrails are needed to make the most of the AI revolution for health? Who would like to jump in on that one? And we can have several folks respond. What's coming to mind in terms of the guardrails that are needed for AI for health?
I'm happy to answer that question. From my perspective where I sit, one of the most important pieces is that the AI models, I believe that 70% of the information that's fed into the current AI models is very Western, and we are trying to take it global. And so one of the most important guardrail is for us to recognize that the models have the right kind of information to give us the right kind of output, ensure that the model is inclusive enough to provide the right kind of output for people. And I know AI is fast evolving, but it's also in very early stages. You could look at it both ways. So I think ensuring that the data is very inclusive is one of the most important guardrails from my perspective.
Absolutely. Ben, go ahead.
I was just gonna, Zubaida, I was gonna mention the same one, and Ivor Horn is very involved on that front, the training data and so on. And then this other piece is making sure that AI, it's kind of a double-edged sword, making sure that AI tools are designed so that they can help most marginalized groups. But then the flip side, we could take that too far, and you could imagine a dystopian future where the rich people get human care and the poor people get only AI care, which could be good or could be bad. But yeah, a lot of risks there. So those are the other two conceptual pieces in terms of guardrails that I would put on the table that we found in the research.
Great, thanks so much. Let's see, what else? There's a lot of AI questions, which we'll definitely come back to, but I'm trying to mix them up a little bit. There's a question about, I think this might be for you, Zubaida. How do businesses respond to country policies on care leave? This always seems to be one of the main stumbling blocks in the US.
No, I think that when policies come into play, businesses are the first to adopt, right? And I think when you don't have a policy in place, that's when businesses are a little hesitant to jump on board. Especially when we spoke about the policy in Germany for paid care leave, or the policy in Uruguay. I think it's when we are able to lobby for the right policy to be in place, it's easy to bring private sector on board. In the US, we are seeing based on the efforts that we're seeing, at least in the financial services industry, we're seeing that if women are expected to work extra hours, there are certain companies now stepping up and saying, here is an annual budget for childcare, and if you're going to work outside of office hours, you can use this money, right? So they're being very cognizant, and I think it's also considering both men and women, if it's a two-person household. So I think companies are adapting to this. They're also providing incentives for them to take mental health breaks and ensure that when they are burdened with care in whatever way or form, it's self-reported and HR works with them. So I think we're seeing slow movement towards that, but there is not necessarily a policy in the US. And I would say if there is one, it's easier for companies to adopt it.
It would seem to me that in the US, we almost have the opposite situation where you have certain sectors of the economy that are well resourced, kind of leading the charge rather than government, which is creating, similarly to what Ben mentioned in AI, the situation where we have an income gap around access to these services. People that have high paying jobs, high profile jobs, companies like Google and others, are providing paid family leave, they're providing, pregnancy and new parent leave, they're providing childcare. And in a lot of those ways, the expectations that those companies are helping to reset in the United States are bringing up the bottom. If you have a friend that works at a place that has all of these services and you don't, you're more likely to be aware of what you don't have and are more willing to go for jobs that have it or to lobby state or federal government to get them. But, we still live among the Western nations in one of the countries that just does not recognize a substantial amount of paid family leave or pregnancy leave. And I think that absolutely needs to change. And right now it's the private sector is one of the only places to get it.
Yeah, thank you. So there's a question about young adults and youth. And obviously these trends are about, things that are changing now, but also things that are changing in the future. And as I think we all know that young adults these days are a group that often is feeling particularly frightened by the future. What I'm curious, I'm paraphrasing the question, but what is your sense of how young people are responding to some of these trends? What offerings did you see that were sort of particularly targeting young people? Any comments about that?
We saw a lot of human-centered and participatory design in these processes. Really none of the examples of what's really working that you're going to see related to these trends in other countries are sort of top-down or policy level approaches. There are a couple maybe related to nutrition, but the rest really are very participatory. One of the coolest ones was a park, I believe it was in Kosovo, that used Minecraft as a design function, a design feature. And so they wanted to get young people involved in the design of this park. And so instead of getting them to attend some sort of, workshop and do it the way the designers would, they, empowered them to do this through Minecraft. And they built a scale model of the park in Minecraft and let kids build what they want in the park using Minecraft blocks. There are ways to, leverage existing tools, meet young people where they are, and engage them through those tools in participatory design processes. And we're absolutely seeing that in some of these examples.
Just to add to that, Kirby, I think, we are at a point where we have to build the future with the young and not for them, but with them. And the trend is that, the example that George just gave is like, you really need to enable them to create their future and be along guiding. We are not in a point where, like our ancestors, they built the future for us and said, this is what's good for you. In many ways, I think the trend is shifting. And so to engage them earlier on is the right thing to do. And especially with the AI and the lack of human touch to many things, it's going to become more and more important to have at the front and center or in designing any models you want for the future.
I love that. I love that. We have to build not for them, but with them for young people. That's fantastic. There's a question, and Ben, you might want to start off with addressing this one. But as George mentioned, a lot of the innovative practices were more community driven. But what did you see in terms of policy changes that might facilitate the growth of these sort of grassroots efforts and community efforts? How did you see sort of policy and these more local efforts either complementing and being synergistic, or perhaps not, perhaps working at cross purposes?
Yeah, it's a great question, and it's something that we thought about quite a lot as we were putting this together. That there are different kind of mechanisms or evolutions that a specific solution can go through to achieve scale in different ways. What we tried to do in the report was to highlight things at both extremes: national policy changes, as well as really quite grassroots, nascent interventions that might be very small, but that could, if they prove success, could be replicated and achieve scale in the future. I'm just flipping through the report, particularly for nutrition. There were a few policies that were really interesting. Mexico, where I am right now, has a junk food tax. South Africa has a healthy food subsidy program. Chile has a ban on TV junk food ads targeted at children. So these are some examples of some of the policy level pieces that we profiled. We also profiled Vienna's social housing system, which is, I guess, not a national policy, but a city level policy. And this one is, I think, very actively being sought out by US practitioners in housing. Many of you may be aware if you're on the call. But I recently was working with some affordable housing developers in LA, and they said there had been a delegation organized to go to Vienna to go check it out and try to understand what's different about that model. And as pricing flips around and construction costs go up and down, different solutions start to all of a sudden make sense in a way that they didn't 5 or 10 years ago. So I think particularly in California, there's a lot of interest in interesting. Our housing system is sort of flipping around, and it looks different than it did, and maybe different lessons can be learned from different places around the world.
Zubaida, Georgia, if you feel free to jump in on that question as well in terms of policy. And so we have time just maybe for one, maybe we can squeeze in 2 more questions. There was a question particularly around health equity solutions for non-binary people. But the question is, any beacons of hope from other countries? So I know that, you looked at gender issues throughout this report, and I'm wondering if you came across particular things that were of particular interest that were really kind of looking at gender beyond the binary.
I can share a quick thought on this, which is it wasn't featured in the report, but through some other work that Dahlberg has done recently, looking at innovations and global health with UNICEF, We looked in particular at how HIV care is being delivered around the world, and there are some very thoughtful models of how to reach marginalized populations, which can in many cases be either sex workers or trans folks or the various other groups where there's disproportionate HIV rates. There's some very thoughtful models out there for how to meet folks where they are, to create safe spaces outside of the traditional healthcare system so that you can maybe go and get services without having to face all of the stigma and not fitting into the right boxes in the mainstream health system. So I think that's one area, and I could see a future where we learn from a very narrow sort of intervention area like that around HIV, but apply those lessons much more broadly. I mean, there's no reason that you couldn't have some of those thoughtful models for meeting people where they are in other areas beyond HIV.
Yeah, thanks. And I'll just add, this was not part of this report, but we have been looking at how other countries have created data systems that are much more inclusive of the whole range of genders. And there are many countries that are doing fantastic work in terms of really working with those populations to find and develop questions that can be incorporated in a range of forms and data instruments that gives the responses that feels inclusive to those populations. That's one of the first steps is, you have to know how many people there are in order to provide the services and respond to their needs and challenges. So that's a ray of hope as well. All right, one very quick last question for you all. This is really about intergenerational programs. The question is, what type of intergenerational programs are set up to scale? Right now, only nonprofits are being creative on local levels. So I think anything you want to say about these kinds of intergenerational programs? I don't know who wants to.
I'm happy to take that because I think we are working on it. Like right now, we're thinking about intergenerational impact of poverty and how we walk people out of it. The big question here is, I believe, yes, nonprofits are doing great work, but the kind of work we're talking about, especially in health inequities and poverty, beyond that, it needs to be replicable, not scalable, right? Because that's what we're talking about in this report as well. What can we learn from Germany, or what can we learn from Bogota? So I think the concept of scale sometimes is overrated, because to scale something, you need to be able to adapt it, and you need to be able to make it your own. Except for AI models, right, where you can say, yes, I want to scale this model. What if somebody from Bogota is going to relocate to Uganda? And we have this global model from which we can pick up something. So I would say that we should think about, when we talk about health inequities, when we talk about poverty reduction, we should more look at adaptable and replicable models than models that can scale.
And I'll just add, there's one example of medium scale that we included in the report in Japan of mixed intergenerational mixed use housing development. I think it's something like 5,000 units. I believe it was public sector led. But yeah, I think tricky. And there are some of these models in the US as well, intergenerational housing, but they are quite nascent. And as you mentioned in the question, small scale and nonprofit driven.
I'll also add that, I think the interesting part of that question to me, Judy, is, the word set up to scale. I think, in all of these places, when we were looking at these interventions related to these trends, each of these places had kind of a permissive ecosystem around them, right? There had been something about that place that allowed this response to grow there first. So Japan, for instance, in 2015 proposed a government-wide, nationwide, they called it a Platinum Society Plan or something like that, Ben, where they really were reimagining, as their aging population was growing, the role of elders in society and how they could redesign government services, housing, everything to sort of like acknowledge the fact that more than a quarter of their population was already over 65, and that was meant to massively increase over the next 50 years. And I think it is interesting to look at these projects that are at small scale, the ones that have gotten to medium scale. Can they be replicated? Can they get to a larger scale? But the answer to that question is in my mind not so often is it smart enough, the sort of the technology of the intervention itself, is it smart enough, but like is the environment that thing has to live in supportive in that way, or is it permissive of that thing? And so one thing we saw throughout the report is it's not just about these smart interventions, and we're not asking people just take this idea and replicate it to make your own Minecraft-based park in Baltimore. We're saying like, what is the thinking? What's the policy? What's the collective action that set up the preconditions for these things to be successful? And certainly that was the case for this intergenerational project in Japan, things that we've already seen in other countries like Scandinavia, places where, kindergartens are being sort of located inside, elderly homes, for instance, or healthcare facilities.
Right.
Again, a place where like there was a culture that could allow for that first. And so I know it seems soft when we talk about culture that way, and sometimes these interventions, even at a small scale, can help drive that cultural conversation in order to allow themselves to scale. But ultimately, it isn't, in my mind, it's not about the tool itself. It's about that culture, and the tool has to fit within it.
That is such an important point, George, and actually a perfect way to end this part of the webinar. I want to thank you all for your responses and this really great conversation. I actually have a question for the audience now, which is, of course, we hope that you take this report and it sparks conversation. I would love to hear which of these 6 trends resonate with you the most, and just a little bit on how today's discussion may have inspired you or sparked ideas in you. If you want to add something to the chat on that would be great. So, and while you're doing that, I want to thank Zubaida, George, and Ben for joining us today for this really interesting discussion. And as they said, this has been a really special project, I think, to all of us. It's been it's just been a great experience all around. We will make this report, we'll make the recording available to everyone so that you can listen to the conversation again later if you'd like, and please share the recording with anyone who might be interested. After you sign off, please take a very quick minute to fill out a very short survey that's going to pop up on your screen. Your feedback is really helpful to us. We do use it to design these webinars. And as always, stay safe, be well, and see you on the next Reimagined in America webinar. Bye-bye.